Erie News Now was the first to tell you last year that Erie, Pennsylvania temporarily housed nearly 150 unaccompanied children after facilities near the U.S. Mexico border became overcrowded. And ever since, Congressman Mike Kelly has wanted some answers. And while he has received some information, he tells our Washington, D.C. correspondent Rachel Knapp that many of his questions are still left unanswered.
I left and I said, well, I'm going to need to know, and I need to see the contracts that you're all involved with, and we need to know.
Representative Mike Kelly discusses his time trying to visit the Pennsylvania Academy site on Oliver Road off of Peach Street in Erie last April. The Department of Health and Human Services used this as an emergency intake site for nearly 150 migrant children. But their stay was relatively quick. Within days, the children were moved out. Ever since, Kelly questioned the department secretary, even sent several letters trying to get info about this site and about the children. In a letter, the department says the kids were transferred to another emergency intake site in Michigan or other state licensed facilities or placed them with vetted sponsors. We learned the dormitories they were using at the Erie site were in need of extensive repair. Inspectors citing about 30 gas leaks with open PVC pipes allowing direct access for rodents. In previous reports, gas was shut off in some wings and space heaters were brought in, but the government moved quickly to relocate the children.
If they had some concerns with that facility, weren't those concerns taken care of before they brought the children in?
And lastly,
what was the total cost to our taxpayers?
Kelly says the department sent a contract, but it's unclear how much this temporary stay cost.
HRS 1257, introduced by Representative Mike Kelly.
In hopes of getting all these questions answered, Kelly is sponsoring a resolution which would require the HHS secretary to provide copies of the contract with the Erie site to the House of Representatives.
What they came back to us with is casual and it's incomplete, and it doesn't get us to any solid answers. And I think it's time. I think our taxpayers expect it, our citizens expect it.
At the Capitol, Rachel Knapp reporting.
Well, we reached out to HHS on this, but we did not hear back before this story aired.